Hello, I am thanking everybody. I am Dr. Ardhan Chatterjee. My Facebooks are Free Homeopathic Study, Ardhan Chatterjee, Ardhendra Chatterjee, City India Homeopathy, and Jivandeep. I am now telling about something of geriatric disease, some practical experiences. It is very important because old person are almost neglected by different means in India where the birth rate is greater than low death rate and the number of the old person are increasing day to day and maximum number are living under poverty line. But not I am going to that condition, that is economic deprivation or poor economics, this and that. More or less, you know everybody that in repertory, Dr. Kent's material repertory, genetic diseases are discussed, present in different rubrics in three names, three directions as old age, disease of the symptoms of the old age, aged person, and senility. Today I am first taking about an old lady of our neighborhood, 75 years old. They have many money, economically sound and strong. The lady, her husband, old husband, lady 75 plus, husband told me that her wife is under coma. Coma for 5 days, no stool passes for 20 days. Now deep snoring and all are waiting for his gradual decline or peaceful death. And this old fellow loves homeopathy to some extent. They have money, so they have called different doctors. They told at that age the coma should not be revived or returned. Consciousness will not be returned, so she will die. Anyhow, she told me whether we have any medicine homeopathically or not. I replied, yes, our opium is the best medicine. Deep snoring, no stool passes in the no for 20 days. It is opium. Give him opium 6, low potency. Because dynamic vital force is very weak. And after 10 doses of opium to 2 hours interval, her consciousness started to return. After 40 doses, the old lady started to evacuate stool and horrible offensive smell throughout the locality, and they oppositely complained against me whether we homeopathically give some medicine and his intestine become putrid and ulcerated and evacuated. Anyhow, after 3 or 4 days of evacuation of stool, the lady became cured and started to deliver his old work and to take care of his old husband as well. My second case is one day at evening not at night 9 p.m. by stretcher on one old person brought to my chamber. She has totally lethargy, could not walk, could not talk, could not change his posture, and severe vertigo. He protruded his tongue. Then I puzzled what I will do. I am trying to take the case, but instantly my third eye, as every physician, everyone you possess, one intelligence developed within my mind. I have a big bed. I advised them to lie, and I started the posture of the patient. And I learned that while the patient became lying on left side, his vertigo relieved to some extent. And I prescribed, according to repertory Dr. Kent, I prescribed muriatic acid 200 only dose. At that time his pulse rate was okay, pressure was 160 to 80. Within 15 minutes, the patient's vertigo gone off and patient started to talking. And after 1 hour, he wanted to go return his home by walking, on walking. Remember, patient came with stretcher and wanted to return his home on walking. I checked his blood pressure. At that time his blood pressure was 200 to 100. Previously when he came with vertigo, it was 160 to 80. When he returned his home by walking without taking any other cell, his blood pressure became 200 to 100. That means it was a case of essential hypertension. And the patient was alive so many years and treated homeopathically to me. I don't know when he died, probably I forgotten, but muriatic acid proved very effective medicine. When the patients are coming, even cardiac patients are coming, patient used to lie on vertigo because vertigo is also one of the leading symptoms of malignant hypertension. And constipation, fissure rectum relieved by external worm, constipation developed by meat, involuntary stool and urine, etc. etc. My third case I am representing here, it was treated by Dr. Prados Majumdar, Rector, Metropolitan Medical College. He came in Kasabara to see a case of cancer esophagus. Probably Dr. Poddini Mukherjee taking the case one day before coming. Dr. Prados Majumdar prescribed him lactasis 1 mg only dose. And lactasis 1 mg only dose allow him to swallow the food so well. But the party, they were very miser type. They are not giving the total fee of Dr. Prados Majumdar. They are not continued the treatment homeopathically. Her daughter also a matron in a medical college, National Medical College, it is another issue. And they did not continue the case. One night they called me to see the case that the old fellow, 80 plus, could not swallow again for 2 days and severe asthma. I went there home and checked his blood pressure was 90 to 60. Severe asthma, no stool passing, not eating for 2 days. I prescribed arsenic album. Arsenic album 6, 5-minute interval, and her cough discharged by mouth and swallow, her chest become free. And when his chest become free, his blood pressure down to 80 to 60. Down to 80 to 60. I told the old fellow, could you eat anything? The fellow, old person, agreed. I told him to give some food. They gave his soup as prepared in the morning, and the old man swallowed. And it was a December night, too chilly. So I told him, could you eat tea? The old fellow replied, yes. They make tea 1 cup for me and 1 cup for this old person. When he drank the tea, his pulse rate was 30 per minute. Pressure was 60 to 40. Like that. 60 or 70 to 40. Totally patient exhausting gradually. They know, they understand. I told them during the checking his condition is too bad. It is better to hospitalize, and they disagreed because from hospitalized the patient was returned different times. So they told that yes, my father is okay, he is eating, he is drinking, that's enough. And I I returned my home at 2 to 3 p.m., 3 a.m. At midnight, within 15 minutes, the patient was slept. I told him go to sleep, and the patient was asleep and died within 15 minutes. I am telling 3 cases here about my typical experience of geriatric diseases, and next time I will be happy if I come to you with some new cases. Thank you.